If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman, and today we're going to focus on the yeast connection. The yeast connection dates back quite a few decades to the work of Dr. Orion Truss, and then popularized by Dr. William Crook in his groundbreaking book, The Yeast Connection. The yeast connection really made a difference in my practice over many decades. It's a way of solving mysterious illnesses and accounting for a panoply of very, very distressing symptoms that sometimes elude conventional diagnosis. With us today is the author of an update on the yeast connection. 40-some years later, we have a new book, Conquering Candida, the new 30-day protocol for restoring your microbiome and health, with Dr. Dean Mitchell, the co-author with a nutritionist. He has put together this update on the yeast connection. And what is really, really exciting is that his training is very rigorous. He is a board-certified allergist, immunologist, and he's also an integrative medicine specialist with over 25 years of experience. And New York is so big that it swallows up people like Dr. Dean Mitchell because it's not a close-knit community. I'm meeting him for the first time, even though he is my neighbor here in Manhattan. He's the founder of the Mitchell Medical Group in New York City. He's also a national leader in something called sublingual immunotherapy, which is an innovative way that helps to avoid shots and is a safer and more natural treatment for allergies. And so we're going to delve into that. He has a previous book entitled Dr. Dean Mitchell's Allergy and Asthma Solution. So I'm very much looking forward to our conversation today. Dr. Mitchell, it's a pleasure having you on Intelligent Medicine. Thanks very much for joining us.
Dr. Hoffman, thank you for having me on. Although you had not heard of me, I have heard of you. I've been a huge fan for many years listening to your radio show. And you have been also really one of the groundbreaking leaders in functional holistic medicine for many years. As I said, I remember 25, 30 years ago hearing about you. I know patients that had seen you and usually said wonderful things.
Indeed. And you also, from what I understand, do a podcast, right?
Yes, actually, it's funny. I wish I had your radio voice, though. It's funny. I tell people the story. It was really about 5 years, maybe a little 6 years ago, right before COVID broke. I was coming back from a rare vacation in Europe, and I was on the plane. And every once in a while, I kind of say to myself, what kind of new challenges or something do I want to do in my career? And I said, I love learning. I mean, that's where I've done a lot of things to incorporate my practice. But I said, I also love talking to doctors and how, I was actually also always a big fan of like the Charlie Rose show, like those really personal interviews and conversations. So I said, maybe I'll start a podcast. I had just started listening to podcasts at the time, and I really enjoyed them. And I said, okay, I'm going to try to get started doing this, although it was quite challenging because this was also, just to date myself, it was before COVID. It was a little bit before Zoom really hit. So I had to get the interviewees into the studio.
Okay.
That
Yeah.
was a challenge, as you
Yeah.
may know. And then it was interesting because once COVID broke and Zoom came about, it just changed everything. So now, like yourself, I interview doctors all over the country, even sometimes in Europe, because I want to learn and I want to share with my listeners the latest things. Because as we both know, I mean, today with ChatGPT, whatever, you can get a lot of information, but there's nothing that substitutes the experience of a really good clinician in their field. And like yourself, getting a chance to spend 45 minutes or an hour with them, I really hope my listeners, and I know I do. I always tease people because I tell them right away when they hear it's called the smartest doctor in the room, they laugh. They're thinking I'm bragging. I said, no, it's all my interviewees. I said, but if I wanted to change the
You're
name,
inviting the smartest doctors in the room
right?
into your room. Yeah.
I said if I wanted to change my name of the podcast, I would call it "Becoming the Smartest Doctor in the Room" because I think
Great.
eventually I'll get
It
there.
might rub off by osmosis. Yeah. Great. Okay. So to situate this issue, you well know, as a rigorously, conventionally trained allergist immunologist. This is a subspecialty in medicine. You usually train in internal medicine. You go for 3 years, and then you
Right.
have additional training. That is what, like 2, 3, 4 additional
Just 2
years.
years.
Subspecialty training that's very rigorous, that delves into all manner of study of the immune system. That's what it's about. And then you become an allergist, or you become someone, who handles immunological issues, people with, the bubble boy syndrome, where they're susceptible to everything because they have virtually no immune system, all that stuff. And you well know that when we first started talking about systemic Candida infections, that this was heresy, because
Absolutely.
in medicine we actually, there was no gradation. There was either you had a vaginal yeast infection, or maybe if you were really in trouble, maybe you had oral thrush, or else if you had what was called systemic candidiasis, you were on death's door. This would be like a terminal AIDS patient, or somebody
Right.
who had a bone marrow transplant and had virtually no immune defenses, or had undergone rigorous chemotherapy and radiation and had no immune defenses, and then Candida could then affect them systemically. So this notion that there is somewhere in between a syndrome that causes complaints, not necessarily life-threatening complaints, but bothersome and sometimes devastating complaints, this was considered a heresy. So you took a different road that may have actually exposed you to some criticism from mainstream allergists and immunologists, right?
Absolutely. And it's interesting the way you framed it because sometimes in life too, it's what you're exposed to can set, the path of your career. And one of the things also, which was very interesting, I trained in my internal medicine and my allergy immunology fellowship in New York City at the height of the AIDS epidemic.
Me
And my
too. Me
Right.
too. Where did you
So
train?
my internal medicine and my fellowship was an allergy, infectious disease, and immunology fellowship.
Right.
Um, so I got a lot of
Like in
exposure.
the 80s, when the AIDS
Yeah, late
epidemic was
late
cresting.
90s. Yes, I
Right.
mean I always tell people I walked out of medical school onto the internal medicine floor, and I was taking care of 20 AIDS patients,
Yeah.
and it was overwhelming. They
Where
were
did
dying.
you train? What institution?
I trained at St. Luke's Roosevelt, which is now Mount Sinai West, a
Yeah.
few blocks from your office and mine.
Exactly. Yeah. And I
And I
trained at Bellevue, so we really were in the belly of the beast, so to
Oh
speak.
yeah, it
Yeah.
was frightening. I mean, again, look, COVID was another. I guess every 30, 40 years something comes along that scares the pants off of everybody. But that was extremely frightening. But again, to set the stage for what you're saying, which is so important. So, and I understand because again, when I was taking care of these patients, a lot of them had oral thrush or intestinal esophageal candidiasis
Yeah.
and all these kind of rashes and other horrible opportunistic infections.
Fungal infections. Yeah.
Right, because they were so immune compromised. And what so many of our conventional colleagues had trouble understanding, and it took me a while too, by the way. It didn't just come overnight, was seeing in my practice and working with other functional medicine people. And I have to credit my wife, Dr. Ricky Mitchell, who's been in practice with me all these years. She's the one who actually started in the holistic space. But what I learned and I differentiated was that, like Dr. Crook describes in his book, which he didn't really have the science yet to really fully explain it. That's what I try to do in my book now, Conquering Candida, was that it's not so much invasive systemic candidiasis, it's overgrowth. And it's very similar to celiac disease and gluten sensitivity. It's essentially the microbiome is imbalanced. And this is what creates the significant symptoms. And that's what, a lot of times, I'm sort of like yourself, when I would have a patient, they would come back, I would evaluate them and feel that their symptoms were due to candida overgrowth. And they'd say, I went back to my doctor and he said, this is nonsense. So all of a sudden, there's this battle between me and the patient. And I have to explain to them carefully. And I said, I'll be glad to talk to your doctor also. And on the occasions when I did, it really only took me about 5 or 10 minutes for the doctor to say, oh, I get it now. I see what you're saying. Because, a lot of times people don't describe it properly. They say, and this was just so important. And, what Dr. Crook recognized, and I tried to elaborate on, but again, take it a little bit step further, was that unfortunately, the overuse of antibiotics is probably the biggest reason I see candida overgrowth. I mean, I see so many young people that were on the tetracyclines for acne for months. I see so many patients that were on a lot of antibiotics for Lyme disease or urinary infections or common sinus infections when they probably didn't need it. And this upsets the microbiome. And this is what starts to lead to other illnesses. And the one other, Dr. Hoffman, I can explain, which is very important. And again, sometimes doctors don't like this. They would hear leaky gut. And they go, a gut doesn't leak.
Yeah.
But Dr. Alexio Fasano, who I got to fortunately interview on my podcast, he did the groundbreaking work showing that in celiac disease, in fact, they do have leaky gut because the cells in the intestinal lining are only one cell thick. And when there's inflammation in there from, let's say in that case, the gluten inflammation, the cells open up. It's almost like a little drawbridge, and the allergens, antigens, microorganisms can get out. And when they leave the area where they're supposed to be, they can cause inflammation in other areas.
Indeed. So we're kind of updating the concept of chronic yeast infections or systemic candida with the addition of what has become popularized and well acknowledged, which is microbiome imbalance. But when we talk about microbiome imbalance, we're generally talking about bacteria. And in the gut, we might have a mycobiome. In other words, a fungal natural balance of fungi that actually live within us. And sometimes that gets out of balance. And actually, there's an interaction with the bacteria and fungi. And this is, so we have to kind of open our lens a little bit on the yeast connection and incorporate the notion of microbiome imbalance as well, right?
Absolutely. I try to almost in the second chapter of the book address that immediately and actually reference top experts, because what you're saying is spot on. This is where the exciting part of medicine, I think, today is that and some genetic work. The microbiome is a fascinating area, but one of the things we pretty much acknowledge now, a very healthy microbiome is a very diverse microbiome, meaning that, like as you just mentioned, there are fungi, there's actually parasites, there's bacteria.
Viruses, yes.
Right,
yeah.
Viruses. They have to all live in some kind of harmony.
Mm-hmm.
But what happens is, for example, again, you introduce antibiotics or strong proton pump inhibitors, or in some cases with the women estrogen, like birth control. You now change the microbiome and it becomes more homogeneous. And since fungi and candida in particular are hardy organisms, the bacteria get knocked off first. So now all of a sudden you're left with this homogeneous microbiome to some degree. And that's what sets off the inflammation and the extra intestinal symptoms, like as you mentioned with women, vaginal yeast infections. Now, one of the things, Dr. Hoffman, I found fascinating early in my career was some of these men that I helped with chronic sinusitis. And, I didn't get it at first, but I'll never forget when I started to realize this. And, a lot of chronic sinus patients get treated with a lot of antibiotics and a lot of oral steroids.
And steroids and nasal steroids, which
Right.
also
Right.
suppress the local immune system, so the resistance is lower.
Exactly.
Yeah.
And what would happen, this was kind of fascinating, especially early in my career, because I'd have a patient that would come to me, was from, suffered with chronic sinus, was seeing his ENT, had 2 surgeries, keeps on antibiotics. And then I would use a combination of the diet, antifungal medications, sometimes immunotherapy, and they got better. And, one of the things that took me back to medical school, believe it or not, histology, is that the cell structure and the microbiome in the vaginal area is almost identical to the sinus. They're just obviously in opposite areas.
That's a mucous membrane.
So it started to make sense. And, again, I started to recognize also Candida in men. I mean, that was, again, the other thing. It was like, we always associated, I just thought women could only have, Candida yeast infections or overgrowth. But in fact, it's just as common in men, but the symptoms appear a little bit differently.
What's so bad about yeast in particular? How does it wreak havoc on the body? There's several pathways by which it can exert its harmful effects, right?
That's a really good point. And actually, that's something else that I specialize in that really shed light onto me. I see a lot of toxic mold patients, which I didn't know anything about 10 years ago. And I sort of fell into it, by a patient pushing me, help us with this, whatever. But to answer your question, because they are similar, so, mold is obviously really external, and like Candida, is internal. But they release mycotoxins, meaning they release different type of chemicals in the body that cause issues. And one of the other things I mentioned in the book, which this is something that I came up with, and I'm not bragging, but I guess in medicine we're taught to stage things, and I was seeing so many of these patients that I actually came up with a stage 1 to 4.
Mm-hmm.
Initially stage 1 was the intestinal stuff.
Right.
Stage 2 was the vaginitis, sinusitis, or the rashes. Mm-hmm. Stage 3 was the brain fog, which again got ridiculed until COVID.
Right.
And then stage 4 was when the patients had severe chronic fatigue. And it was interesting, Dr. Hoffman, one of the things that helped explain the brain fog, which again has been so mysterious, is that when patients have a lot of Candida circulating, especially in the brain, it turns to aldehydes and alcohol.
Uh-huh.
And that's why they get this brain fog.
This is sometimes referred to as autobrewery syndrome.
Yes,
but that can also result from bacterial overgrowth as well as fungal overgrowth, because it's kind of like the difference between yeasted bread and sourdough bread. There are a couple of ways that you can make the bread rise and create the bubbles, but you use some sort of medium. But the medium releases not just CO2, which makes for the nice, aeration that fluffy bread has, but also these aldehydes and alcohol, because that's how the same process yields wine, beer, bootleg whiskey.
Right. The autobrewery syndrome you brought up, I actually also mentioned in the book as a case. And I saw one of these cases. They're really fascinating. And although they are extremely rare, but it's really all of the spectrum. I mean, that's the most extreme example. But
that's just obvious, right? Where you could actually measure the blood alcohol and, the person hasn't drank anything.
The story I tell in the book, just for the listeners, for your listeners, it's a fascinating case. It was a woman that, was reasonably healthy, liked to drink a couple of glasses of wine a week. But after a while, it's funny because a lot of them don't have, whatever the enzymes, and their liver doesn't break it down as well. Start to realize she didn't feel well when she drank. So she stopped drinking. But then, in her case, she had been on antibiotics several times in a year because of urinary infections. And she was on a proton pump inhibitor because she had gastric reflux. And then she went to a holiday party one day. And, it was around Christmas time. And, she had a bunch of cakes and, a lot of, good cookies and a lot of fun. And she was leaving the party and she was driving home, and she drove through a stop sign by accident. And the policeman was in the area, pulls her over, starts talking to her, ma'am, you went through a stop sign. Yeah. And you kind of smelled alcohol on her breath.
Get the breathalyzer test.
And he breathalyzed her, and she failed miserably. And he goes, ma'am, you've been drinking. I have to give you for DWI. She goes, officer, I haven't drank in 2 years.
Wow.
And, and it took several, doctors to finally believe her. And she was tested and shown to have auto brewery syndrome.
Wow. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Have you ever heard someone say that probiotics didn't work for them? Since all probiotics are not the same, the probiotic you choose can make the difference between superior results and no results. Look for an enriched formula containing these 3 key components for best results: probiotics, prebiotics, and postbiotics. A worldwide leader in microbiome health for over 40 years, Dr. Ohhira's Probiotics is an enriched full-spectrum probiotic system fermenting multiple strains of probiotic bacteria and nourishing prebiotics. The result? Transformative postbiotic metabolites that maintain and support the biodiversity of flora in your gut for optimal digestion, gut-brain, and immune health. Dr. Ohhira's, certified vegetarian, free of gluten, allergens, dairy, and GMOs. Get Dr. Ohhira's probiotics today at Sprouts, Natural Grocers, Whole Foods, and other natural health retailers nationwide.
Thanks for listening. Thanks for supporting our sponsors. They're what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Dean Mitchell, author of Conquering Candida, the new 30-day protocol for restoring your microbiome and health. So what role do, the use of these acid-blocking medications, they're really powerful now, the PPIs, proton pump inhibitors, Nexium, Prevacid, etc., very prevalent, and often, they're really intended for short-term use. If you have, an ulcer, that was the original intent, and then he said, well, now if you have GERD, you can take them, and, you can stay on for a lifetime. Why would that create a propensity for yeast overgrowth?
Yeah, great question. And, one of the things that you're referencing too is it's fascinating. Sometimes somehow my memory gets jarred, and I remember vividly that when I was in medical school, no less, at the time they were very excited. There was what was called the H2 blockers, I think, like ranitidine and stuff like that too. And they're like, "Oh, this is going to change."
Famotidine, ranitidine. Right. They've taken ranitidine off the market, Zantac. Now it's Pepcid.
Right. But I remember still in medical school too that there was, again, maybe it was in pharmacology. They were like, oh, "Wow, there's going to be this new medicine called proton pump inhibitors, which is only for people that have something called Zollinger-Ellison syndrome, which is when you get tumors in the
rare, a rare condition,
right? Rare. But this is what this medicine was indicated for: is tumors in the pancreas that make you secrete so much acid that you get ulcers, and these people have to take it. So I remember just remembering that, and then later on, years later, there's this new proton pump inhibitors that are good for people with bad ulcers, and then before you know it, it's over the counter now.
Just for indigestion.
Right. You're better off with baking soda.
Right.
So, but anyway, to answer your question, so what happens is these medications significantly alkalinize, to way too high a degree, your stomach and intestinal tract. And this lets the Candida overgrow, because that's why you need stomach acid. Mm-hmm.
And that's why sometimes women with vaginal yeast infections, they use boric acid suppositories, or they use lactobacillus acidophilus, which is an acid-loving probiotic to restore the pH balance vaginally to prevent the proliferation of the yeast.
Correct. Yeah. So
we're actually several ways we're setting ourselves up for problems. What about diet? Because, our diets, I think, are certainly contributing to an epidemic of Candida problems.
Yeah. I think, this is the interesting thing about the Candida diet also. It's funny because, years ago, if somebody was gluten-free and dairy-free, they were looked at as like a weirdo. And then all of a sudden, the whole gluten craze, it was very good for me to help my practice. It made it more accessible now when people go to restaurants and they say they're gluten-free. You're not so strange anymore. Now you're cool. Like all the celebrities are doing that. But the thing is that, the diet definitely, our super ultra processed diet with simple carbohydrates, because also Dr. Hoffman, you probably remember too, I think it was more in the 90s. I know I was already in practice. fat was the enemy.
Yeah.
So what did
everything was low fat?
The food companies do?
Fat free, low fat. Yeah.
Right. Everything that was fat free was super, processed carbohydrates.
Right.
So I think our diets got really affected. I know myself included during that period of time. And the only thing is, which I mentioned in the book, because I've seen so many of these cases too, as restrictive a little bit in the beginning as the Candida diet is, you can't reverse or correct the microbiome on its own. And because I've seen people frustrated. They've followed a strict diet for 2 years, which is impossible. Yeah. And there's still only about 10 or 15%.
You can't starve the yeast necessarily. You can prevent a proliferation, but once it's found its niche, it's hard to eradicate without something else.
Right. You have to rebalance them. I mean, people are so grateful, when I'm able to use some vitamin therapy, use antifungals with them, that they quickly, honestly, get better. And then we try to work a reasonable diet. I mean, that's one of the reasons I put the diet plan in the book, because I really feel that the main tenets of a good, healthy diet, and especially for Candida patients, is high fiber, which makes sense, and low glycemic. But that doesn't mean zero glycemic.
Doesn't necessarily mean carnivore or keto.
You don't have to be carnivore, ketogenic. I think that's extreme. I think it's very difficult to follow. I think, and I also like to point it out. The microbiome likes plant-based foods. For example, I always call ground flaxseed good carpeting for the gut, and berries and apples. With the fruit and the fiber. This is all good for your bowel movements, which is important. I mean that. Constipation, again, is another risk factor for Candida overgrowth. When you're not moving your intestines, you got a problem.
Indeed. What's your repertoire of treatments for Candida? Because it's very controversial. There's like naturopaths who said don't use drugs. We as physicians, we have the option of using natural approaches. We can use Podarc OT or caprylic acid, various natural things, or we got the prescription pad. We can use nystatin. We can use fluconazole. There are other, newer, more potent antifungals. What do you use? What's your protocol?
What I like to use, and again, I'm fortunate since the days of Dr. Crook, because he was pretty limited back then. He had nystatin, which we know is a good antifungal, but it only works in the intestinal tract. It doesn't go outside of there. So
it's it's a pipe cleaner. It's not systemic.
Exactly. A perfect explanation. But when you have symptoms outside of the gut, vaginal yeast infections, sinus infections, the fatigue, it's not going to help for that. So fortunately now we do have a really good arsenal of very relatively safe antifungal medications, from, diflucan to Sporanox, and even some newer ones that, again, for a short period of time work very well. I mean, the biggest mistake that I see is that it's underutilized. Like even gynecologists are afraid of antifungal medications. I see down their head, it's liver toxic. And I've used this extensively for decades and not seen one case. And it's not that I'm so unique. I actually, on my podcast, I interviewed Tom Schiller at the CDC, who's in charge of the fungal branch at the CDC. And we were talking about it, so I was interested in his experience, because he sees really nasty, like lung fungal infections and everything. And he uses doses 2 or 3 times higher than I did. Yeah. And he said, 18, he goes, I hardly ever see a problem with it. So I think the treatment is underutilized. I mean, of course, I don't want people on it forever. I usually have a few weeks, a month, get them cleaned up, transition to nystatin. And then I'll sometimes do some of the herbal stuff. I just find the herbal stuff in the beginning is too weak. Yeah. And I don't also like to when people are taking 20 things. It's just, it's silly when one thing could really do the job and move the needle.
Yeah, I mean, there's natural substances which are antifungal, yes. Peppermint and oregano, among them, that, even garlic can suppress. But that's more for maintenance therapy, because perhaps you don't want over-reliance on medication once people are well. Right. Perhaps there's also concern about, just as antibiotic resistance can arise, you can have antifungal resistance. So maybe, being a little bit supple about trading off different strategies might make a difference. Right. Okay, so we've laid down the groundwork for our discussion on the yeast connection. I have more questions, but I also wanted to talk about a relatively new concept that interrelates to the yeast connection. It's called MCAS. I'm sure you're very well familiar with something called mast cell activation syndrome, which I think is a revolutionary concept that really knits together a lot of the enigmas that confront folks like you, allergists, immunologists, patients who have just very resistant symptoms. And we'll tackle that, and we'll also talk about sublingual immunotherapy, which is a gentler, safer way of addressing food allergies, an alternative to shots, which sometimes I would have to administer in the office, can be dangerous. So when we return, continue our conversation with Dr. Dean Mitchell. The book is Conquering Candida, the new 30-day protocol for restoring your microbiome and health. And Dr. Mitchell, give us the heads up on your practice here in New York.
It's Mitchell Medical Group. We're in Midtown Manhattan on the West 57th Street. And I really enjoy seeing patients from usually all over the tri-state area. And what's really exciting these days, too, is telehealth.
Telemedicine.
I mean, it's revolutionized, medicine, be able to reach people from long distances away who kind of want to get an idea if I'm the right doctor for them before they actually physically have to come into the office.
That's interesting. So they could have an initial conversation and then, but one of the stipulations of having practiced medicine in New York, I know that you can do telehealth, but at the very least, you have to have at least one in-person visit, I think, to undertake ongoing care. Is that still the case?
I'm not sure if that's true or not.
Can you do telemedicine like remotely in effect?
Yeah.
Okay, good.
Yeah.
Okay, so that opens up a lot of possibilities for people all over the country who are listening to this podcast.
Yeah.
So, okay, great. I mean, and the good news is that, I'm not an allergist immunologist. I did treat Candida and treated allergies, but I think it really maintains an even higher standard when you have the conventional treatment, the conventional credentials in allergy and immunology. You're board certified. So good stuff. All right. When we return, more on the subject of conquering Candida, conquering allergies, and supporting your immune system with today's guest, board certified allergist, immunologist, Dr. Dean Mitchell. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.